Thank you, Mr. Chairman. Thank you, Madam Secretary, for being here as well. We've had a chance to talk in the past about some medical device issues. I want to just follow up and ask a question here. All things being equal, do you believe that encouraging the use of lower-cost alternatives like generics, generic drugs, for example, makes sense for both the patient as well as the consumer as a way to help lower health care spending overall? I assume that's a goal that you would generally agree with.
I think the more consumer information that people have about effective outcomes and prices is great. Absolutely.
And I think we also, you'd probably agree, we have a shortage of primary physicians.
We do. We're
currently
filling that pipeline thanks to some of the resources in the Affordable Care Act, but we do.
Well, I should just share that one of my chief concerns with the new health care law is a provision in there that does not allow those that have flexible spending accounts or health care savings accounts to access the purchase of over-the-counter medications unless they have a doctor's prescription. And I've certainly heard from a lot of suburban moms and constituents in general that have been frustrated about, they get Claritin for their kids or Advil, whatever it might be, and so they sort of resort to having to visit the doctor or the primary physician to get a prescription for Advil or some of these generic drugs. And so it's not accessing a lower-cost alternative to lower health care costs. Do you think that the prohibition that's in the current law should be changed or repealed, or would you be willing to work to modify that to the benefit of more consumer-driven health care for those over-the-counter generic drugs?
Well, I think, Congressman, the notion about the provision was not to discourage the purchase of generic drugs. It was to recognize that health savings accounts are often for health needs that aren't being met. So the same way that most insurance coverage doesn't cover over-the-counter medicines, the health savings account was brought in line with what insurance policies currently have in place. And clearly people hopefully will continue to buy aspirin and buy a variety of over-the-counter drugs. They just won't use their health insurance policy or their health savings account to do that.
Well, and I just want to mention, too, because it's the flexible spending account as well that's an issue. Again, these are their own health care dollars. They set them aside through their employer's plan. And, I have one constituent here who said this rule is really a burden for consumers as well as physicians, since additional office visits are required to get an over-the-counter medication prescription. And these FSAs really are a valuable tool. I mean, they're used by a lot of hardworking Americans to help manage and hold down these out-of-pocket costs. And so this is a significant issue where I don't know if it was overlooked in the concept of the new law passing, but both FSAs and HSAs, this is definitely an issue that I think we should work on.
Well, I would be glad to talk to you further about that.
Okay.
Sure.
Thank you.
I yield back.
Mr. Marchand is ready.